Hey, hello everyone. Thanks for joining me and Jill Chmielewski here with me today to talk all about HRT or hormone replacement therapy. She is a registered nurse and a menopause educator. So, Jill, why don't you tell us a little bit more about how you have moved away from nursing a little bit and into this new kind of realm of the menopause hormone field and what it is that you actually do.
Yeah, so I have been a nurse for 31 years this year. And in 2015, I decided to go back and become a health coach because I have always had that mindset of prevention. Why don't we look to prevent things, optimize things? And so, so in conventional medicine, it's all about sick care from my perspective. And I really like the idea of thinking about healthcare and how to prevent things. So I started working with patients after my health coaching program. And what I found was I was mostly working with women in their 30s, 40s, 50s, 60s. And the same problems were coming up over and over and over. And this is like back in, 2016, 2017, when menopause and perimenopause weren't really talked about. I'm in that same age range. So I'm 52, I'll be 53 this year. So I was going through a lot of those same changes, and there wasn't a lot out there. And when we would start to have discussions about hormones, it was really foreign to women to even be thinking about hormones. They had no education, they had no idea what was happening in perimenopause. I worked in women's health as a nurse, and I didn't know hormones in the way that I do now. So I just took it upon myself to get super, super educated about hormones, about perimenopause, menopause. I've gone through hormone training programs, HRT training programs, mentorships. And so I stepped away from patient care about 3 years ago to really just share education with women, help women understand what's happening in their body so that they can prepare for this time in life. Because we're going to spend, women don't realize, a third to half of our lives in perimenopause and menopause. So it's a big, big period of time. We want to really know what's going on.
Yeah. And I think
Yeah.
I think it's great what's going on Instagram. I mean, even just a year and a half ago when I started talking about perimenopause, there was not a lot of people talking about it. In fact, people didn't even know what perimenopause meant. And I
Yeah.
would have to explain what that meant. And so I think it's awesome that now so many people are talking about it because it is helping to educate and bringing more awareness to the fact that we don't have to just settle for getting old and frail and having diseases and things like that as we move into this like second half of our life.
Mhm.
But there's a lot of confusion out there too, and so I think we can talk about that today. A lot of people on my Instagram even had questions, and maybe we can start out with this, like, what is HRT and what is the difference between synthetic, birth control, bioidentical? Maybe you can go into
Yeah.
that a bit.
Yeah. So hormone replacement therapy is just as its name implies. So it's just replacing the hormones that our body has been making. In this case, we've been making estrogen, progesterone, and testosterone since puberty. So when we're talking about HRT in perimenopause and menopause, we're talking about replacing hormones with hormones. So our ovaries no longer reproduce those hormones in robust amounts. We're living a long time. We used to only, I mean, the average life expectancy in 1900 was age 50. So people didn't, HRT wasn't a thing even 100 and some years ago. Now we're living, 30, 40, 50 years beyond menopause, but our ovaries are not producing hormones beyond, age 35, 40, 45, 50, depending on when you go through menopause. So we want to think about knowing that hormones do all of these amazing things in the body beyond just reproduction. We want to think about replacing hormones during the stage in life because they have a lot to do with sort of this systemic protection of our body or keeping our cells healthy. So, keeping our bones healthy, our brain healthy, our blood vessels, our vaginas. I mean, really every system of the body. So, when we're talking about HRT, there's two different kinds that people will talk about. One is bioidentical or body identical, and one is synthetic. And so, both truly, if truth be told, they're both synthetic to some extent because they have to be made in a lab. So, they are made somewhere else. So people will kind of argue and say, well, bioidentical meat is synthetic. It's just a marketing term. It's not. They both are made in a lab, but ultimately, when the end product, when we're talking about bioidentical or body identical, means that that hormone is exactly identical to the hormones that are made in our body. So estradiol is estradiol, estriol is estriol, Progesterone is progesterone, testosterone is testosterone. Synthetic hormones, really the better word would be like non-bioidentical. So they're not the same as the hormones that are produced in our body. So they're made in a lab as well. They are made into something kind of similar-ish. They're sort of a variation or spin-off of our hormones, but they're different and they can act differently in the body than our own hormones can act. So those of us that are in this space really lean on using bioidentical hormones because our body knows what to do with them. They know how to signal receptors just like our hormones do. Our body knows how to break them down just like, right like the hormones that are made in our body. We only had synthetic hormones available for a while, so that was the only option at one point, and that's not the case anymore. Now we can actually replace like with like. So we lean on bioidentical or body identical. The birth control pill is synthetic, so women know that that is not the same as the hormones that are made in the body. And those are some pretty hefty doses of hormones because to interrupt a woman's monthly cycle and stop ovulation in its tracks, you've got to use some pretty significant and heavy hitters to do that. So the pill is actually considered a hormone disrupting chemical because it disrupts our normal function in the body. So there's a huge difference between the two.
Yeah. So when you're talking to your doctor, um, you know, you want to ask kind of what they, what they're normally prescribing. Is it bioidentical or is it, the pill? Is the pill really the only synthetic that is, or is progestin? Like, is that
Yeah, there's
prescribed?
estrogen like Premarin. Women, a lot of women have heard of Premarin, which is
Yeah.
made from the urine of a pregnant horse. And so we share one estrogen with horses, but I think they have like 12 other estrogens or something like that. So, we don't want to get 12 horse estrogens in our body. We want just the hormones that are really right for our body. So at the time when Premarin was the only option, that was a good option because that's all there was. And it did a lot of good. But now that we have body identical, we try to stay away from Premarin and things like that because we have better options. For progesterone, the alternatives are progestins, which are very confusing for women because the names are so similar. A lot of physicians interchange the names. Like they'll say, I'm putting you on the pill and it has progesterone. There is no birth control pill that has progesterone. They all contain progestins. And so those are very, very different than the progesterone made in our body. They really only share maybe two things in common. They can help control endometrial bleeding or bleeding, menstrual bleeding, and they help to protect the uterine lining. And that's it. Other than that, they have very, very opposite effects in the body. So
Mhm.
those are really kind of the main types of HRT that would be considered synthetic HRT.
And
Yeah.
so you were talking kind of about age a little bit. What
Mhm.
is the age that you would start to consider this, and what age is too old to consider this?
Yeah, good question. So hormones peak in our 20s. So, and the average age of menopause is 51. So we've got this kind of 30-year period of time where we're sort of on this slow march towards hormonal decline. It tends to start to accelerate perimenopause, we call it, in our mid to late 30s. For some women, it's early 30s. So perimenopause can last, 10, 12 years. So if you say average age of menopause is 51 and you go back 10 years, that would mean it could start at age 41 for some women. If some women go through menopause at 45, that could be 35. If it's 42, it could be 32. So I always say in your 30s, if things are starting to change, if you're noticing some symptoms are changing, that's the time to really start to have that conversation or at least seek out a provider who specializes in perimenopause and menopause to have that conversation. You don't have to take any action now, but at least you're sort of have this person lined up. You're talking about what's happening, you're sharing your symptoms, you're tracking them, and you can potentially if symptoms are there and you're showing those symptoms, potentially even start HRT as early as, 35 in some women.
Yeah. And then you had said that your mom started HRT at, 70 something. So maybe,
Yeah.
it all depends, but the ideal time, right, would be to start within a few years of going through menopause. Like,
Yeah, the
yeah,
earlier the better. And we always say
yeah,
the kind of general, not it's not a rule. The guideline has always been, ideally you're starting within 10 years of menopause, meaning 10 years of your last period. But again, we've been going through hormonal changes 10 years before that. So living 20 years then with hormones that are suboptimal, it's going to take its toll on those cells. The blood vessels are changing. I mean, when you look at a lot of the research, by the time a woman has reached menopause, we already see blood vessel changes because of that loss of hormones, and we see bone changes. So, when you're thinking about the way hormones work in the body, the earlier the better. I think a lot of women think about them just for symptoms, and that's because you're having hot flashes or night sweats or sleep issues or maybe anxiety or heavier periods. And those are all reasons for sure to consider hormone replacement therapy. But it's the bigger stuff we're also thinking about, that bone loss, the blood vessel changes, the brain changes, the vaginal changes and genitourinary changes. So we want to look at that system as a whole. Skin changes, all of that.
Yeah, and I think that's
Yeah.
something that I didn't realize is that it's actually protective. It's not
Hmm.
just to minimize symptoms, it's actually something that can protect you as
Yes.
from things, even things like breast cancer, heart disease.
Yes.
I had no idea that we needed our hormones to protect us from those things.
Yes, they play a huge role. I think we think about them in terms of pregnancy and periods, but the way that hormones work is they circulate through our blood and they go to cells and they signal cells through little receptors that look like little satellite dishes. And those receptors, those are on every cell of the body, not just our ovaries and our uterus. So we're always thinking about the period, pregnancy, but we've got receptors for hormones in our brain, our skin, our bones. I mean, you name the system of our body, they're there. So any system, every system of the body will be affected when hormones decline. It's just basic physiology. And I think a lot of women weren't taught that. And certainly even our providers weren't taught that.
Yeah, and
Yeah.
I think almost everybody, if you don't have a single symptom, you're very lucky, but I think almost everybody going through perimenopause has seen something changing, whether it's
Mhm.
their hair or their skin or they're, peeing their pants or they're can't sleep
Yeah.
or, the anxiety is higher. There's all these things that we just kind of attribute to, oh, this is how it is as we get older.
Yeah.
But and not to say that, hormone therapy is going to be the magic pill that's going to save you from every ill that you have.
Right. Yes,
But,
exactly.
there's a good chance that it could help. But one thing that you mentioned was talking to your provider, and a lot of doctors are not specialized in this. They really don't know a lot about this. And some of them, quite frankly, will not prescribe
Yeah.
HRT. So, how do you advise people going about finding the right provider?
It's probably the number one question that I get or message that I get, like, can you help me find a provider? So it's not going to be your OBGYN, most likely. Most women are very disappointed because we think that this is what they do. And OB-GYNs are great at what they do, which is, gynecological surgery. That's really what they're trained to do, deliver babies, prenatal care, gynecological care. Hormones is not in their wheelhouse. And if it is, it's because they've sought out additional training for it. So generally speaking, that's not going to be the direction to go. So it is finding someone just like anything else who specializes in menopause medicine. If you have to kind of strong arm your provider or you're having a conversation with your provider and they're giving you pushback on HRT, it's not a provider you want to work with because you want someone who knows more than you do about it so they can help guide you and help you and support you and feel very confident in how they're leading you through this process. So oftentimes I would say, friends can be very helpful if you have a friend, somebody who has gone through it and is, the main caveat with HRT or menopause providers is they have to be licensed in your state. Like any provider, in order to prescribe, they have to be licensed in your state. They can live in another state, but they have to have a license in your state. So telehealth is a great way to go. A lot of providers practice that way anyway. So that can be helpful. So you can ask around to friends to say, who do you see? I find calling compounding pharmacies. So a lot of women don't know that these exist, but there are your kind of commercial pharmacies like Walgreens and CVS, and there are compounding pharmacies that do very specialized compounded medications, hormones, and other things. The reason I say to call a compounding pharmacy that's maybe in your state is because they work very closely. If they do a lot of hormones, hormone replacement, they will know who in that state is licensed to prescribe and who is really good at prescribing, who is an expert and knows what they're doing. So that's always a good place to go just to find a name. There's different organizations. I mean, there's North American Menopause Society, and there's mixed reviews there. That is really, sometimes I find great providers. I know a lot of wonderful providers who are what they call NAM certified. And I know a lot of providers that are not great at menopause medicine who are NAM certified. So, it's like anything. You've got to kind of shop around for the provider. We're trying to get more and more lists out, but there are some online telehealth companies too that are also good resources that you can look up. There's Joy Women's Wealth, there's Women's Wellness, there's at My Alloy, MIDI Health. There's some other ones out there, I think Winona, that are really specializing in menopause medicine.
Yeah. And I think more
Yeah.
and more will probably,
Yeah.
come up too.
Yeah.
You had talked a little bit, or we kind of brushed on this, but let's chat about the safety of using
Yeah.
HRT. I know a lot of people think that I talked about how it can be breast cancer protective. A lot of people think it causes breast cancer.
Hmm.
So why do people think that? And what is the new kind of research that is coming out?
Well, it's interesting because it was like HRT was always gold standard, and there was no even concern about breast cancer risk up until 2002. So HRT was widely prescribed to women. And then in the 1990s, there was a huge study called the WHI, Women's Health Initiative, that was done. And it was a study actually really looking at menopausal women and trying to figure out if hormones would help them with prevent some of the chronic diseases that women die from, like bone loss, fractures. Women don't realize it, but that's a huge reason for why women actually pass away, is because of bone fractures, cardiovascular health, and other things. So that's why that study was done. And in the process, what happened is the study was prematurely stopped in 2002 because some of the study researchers, this kind of core group of researchers, actually misinterpreted their own study data. And in one arm of the study that this is the group that was using an oral pill called Prempro, which is a synthetic estrogen and a synthetic progestin, like we were talking about earlier. They misinterpreted the data, and they thought that there was an increased risk of breast cancer in that arm of the study, that one alone. At the time when they were interpreting the data, they interpreted it as statistically insignificant, which in medical terms just means it's not significant. We would never base any medical decisions on something that's considered statistically insignificant. But it was sent out to the media. There was a press release about it. A lot of the co-investigators weren't even included in the conversation or discussion about this data. And the media picked it up and said HRT causes breast cancer. And that was it. Everybody stopped prescribing. Providers stopped prescribing. Women dropped their prescriptions overnight. Everybody thought HRT caused breast cancer. Well, soon after, those researchers looked at that data. Other researchers looked at the data and said, actually, that's not true. That was a false statement. And so it took many years for that statement to be walked back. But in 2017, that same group of researchers retracted their statement and said HRT does not increase the risk of breast cancer. And in fact, women taking estrogen had a 29% decreased risk of developing breast cancer versus women who do not take estrogen. So it's almost like it never should have been said because it was never true to begin with. There was never research that showed that it caused it. But this is what people think now, that, well, this new research, it's actually old. Like, we've always known it didn't increase the risk of breast cancer. In fact, estrogen used to be used to treat breast cancer.
Yeah.
So there's a great book we've talked about, Estrogen Matters, that goes into all the details about this. But this is what we're trying to help women understand, that estrogen does not increase the risk of breast cancer. It decreases the risk of dying for breast cancer, decreases the risk of recurrence, even if you've had breast cancer. And of course, it has all of these other protections in the body. So we don't want women to be scared of their own hormones. Our body would not make hormones in this amount that caused cancer. That it makes no physiologic
Yeah,
sense.
like
It
think about
never
how much
has.
you make when you're pregnant,
When you're pregnant, yeah. And
Yeah.
the doses we give in HRT are like minute compared to what we made in pregnancy or during when we were having these robust menstrual cycles. So these are teeny, teeny, tiny amounts of estrogen that we're using, far less than what's in the birth control pill, by the way. And women are very, very open to taking the pill, and providers are very willing to prescribe it. But when it comes to HRT, everyone's like, no, no, no. Well, you're getting a much, much, much lower dose of body identical hormones. And those are the ones that were made in your body. So we just want women to know the truth about it so that they can make an informed decision.
Right. And I
Yeah.
think a lot of people also hear, of course, breast cancer, it's everywhere now. It seems like, so many
Hmm.
people have it and they hear, oh, it was estrogen positive. So estrogen caused my friend's breast cancer. So I'm not going
Yeah.
to take estrogen. Do
Which
you,
is not, it's
right.
right. People say it's estrogen
ER
positive, but it's
positive.
ER positive, which stands for estrogen receptor
Receptor.
positive.
Yeah.
And we would expect breast cells to have estrogen receptors in there to be ER positive because that's actually a sign of a healthier breast. It's more normal looking to have estrogen receptors. So all that's saying is that pathology sample is estrogen receptor positive. There were estrogen receptors in that sample, but it's gotten sort of convoluted and now it's estrogen caused or estrogen dependent. And that's not what that means. And that's where I think that book Estrogen Matters is like just golden. Or on Instagram, their handle is Estrogen Matters, and they're constantly posting
Mhm.
about this so that women can get some clarity around estrogen and breast cancer.
Yeah. And I think
Yeah.
that's part of it is just not knowing, just not having the
Yeah.
education. I know that
Yeah.
you hear things or but
Mhm.
you don't actually have the education. So I think that's why, what we're talking about, what you're talking about is imperative for people just to be informed. Just,
Yes.
when you're talking about your body and how you're going to be healthy, you need to be informed. I know there's a lot of
Yeah.
information and misinformation out there.
I
So
know.
it can be overwhelming for people. And then even within the HRT kind of community, you even have people with differing opinions. Should you cycle your progesterone? Should you not cycle
Yes.
it? Should you be on, bias? Should you not?
Yes.
There's like, so then even when you start to try to educate yourself, then you just want to like run and hide because you're like, well, which one's the right one that they're telling
Yeah.
me?
I try to tell women not to get too caught up in the weeds about different approaches with HRT. I mean, like any specialty. I mean, menopause as a specialty kind of fell off the face of the earth in 2002 because everybody stopped prescribing. So while all the other specialties were getting better and better and better and more definitive in their guidelines and practices and things like that, menopause medicine sort of lagged and it is lagging. And so you have providers that stuck with it since 2002. And so they're sharing how they prescribe. Then you have kind of some newer providers on the scene that are sharing how they prescribe. And the thing is, different approaches work for different women. So I really try when I see providers, and I see this on Instagram a lot of kind of sort of even dissing each other about the way that they prescribe HRT. Different women will do better with different formulations. Some do better with cycling. I mean, there's different reasons we would use different forms. At the end of the day, you have to fine tune and figure out what works best for you, but there isn't necessarily like a wrong way to do it. There's just different approaches and there's pros and cons to each one. And I think rather than getting so overwhelmed, just taking a step back and going, okay, let's just see what makes sense. Like, your body, when you listen to the different approaches, what makes sense to you? Probably none of them are going to be the wrong approach, it's just different approaches.
Yeah. I mean, I have
Yeah.
several friends who swear by the pellets that they get. And then I
Yes,
have other people who had terrible experiences with pellets. So
exactly.
sometimes it does take, though, from what I've heard, many iterations, many different trials to get your dosage right. And then maybe even when you do get your dosage right, somewhere down the line, you may even need to change that
Hmm.
dosage. Is that
Yes.
what you see?
100% because especially when we're applying hormones to the skin or even taking something by mouth, we absorb things differently through our skin. We absorb things differently, just depending on the formulation itself, where we're at. If we're closer to, if we're in perimenopause, we still are making some hormones on our own. So we may not need those higher levels. We might need more later. So, it's not something, once you sort of find your right dose and you're kind of rocking and rolling for a while, typically if we're changing things a little, it's just minor changes along the way. So I don't want women to feel overwhelmed that like it's going to be this huge thing every single time you go to make a change. But if you're paying attention to your body and your symptoms, it's so easy for a provider to say, it looks like maybe we need to just zhuzh your progesterone a little bit or change this up a little bit. And so it's just a little bit of fine tuning, maybe annually that you're doing. And sometimes you'll go years without changing your dose because all is well and you feel great and everything looks great. So it just depends on the woman, but typically you're going to change somewhat over time, depending on where you're at.
Do you recommend like testing your hormones, or what is your, or you just
Yeah.
based on what the doctor wants you to do, or
It's a hard one because there's different, so in perimenopause, it's so hard to test
yeah.
hormones because they're up, down, up, down, up, down. So if we test you when you're up, it's gonna look like you're up. If we test you when you're down, it looks like you're down. In
Mhm.
perimenopause, as a general rule, we say go off of symptoms because that's gonna be your better picture of what's happening. Once you're on HRT, I was always trained by Dr. Rosensweet to use 24-hour urine hormone testing. That's actual collection of urine over 24 hours. That's considered gold standard. I mean, that's gold standard in the hormone testing world when looking at sex steroid hormones, because that's how we get that 24-hour picture. Blood is hard to test hormones just because timing matters. So 24-hour, if anything, is really going to be that gold standard and give you the best picture. But we always, even with testing, if after using hormones, we want to talk to a woman and listen to how she feels in her body to really help fine tune those dosages. So
Yeah,
testing can help. It's we prefer, if we can do it, we like to do it. Not everybody has access to it. So
right,
we'll just go off of symptoms. Yeah.
right.
Yeah.
So are there negative side effects to doing it? Some, people ask, am I going to gain weight? Or what about like edema? Or,
Yeah.
are there, and maybe that's just a symptom or just showing you that maybe your dosage isn't quite right. So are there, things to kind of watch out for if you do start it?
Yeah. So, I mean, there's always going to be this kind of like recalibration process as you bring hormones in. I mean, if you think about like being women and we have this monthly cycle, we can tell each week, we're like, oh, it's that week. Like our body feels different. We're more bloated one week, we're not as bloated. So, when we bring hormones in, we're going to experience some, changes. A lot of women will say, especially, so your question about like just bloating and edema and things like that. So, generally speaking, if we bring progesterone on board, what will happen is for a lot of women, it will actually, progesterone actually sort of sensitizes estrogen receptors. So we can have more amplified estrogen effects. So, and that's not just the estrogen made in our body. If we are using a lot of products that contain estrogen mimicking chemicals, if we're exposed to pesticides, insecticides, things like that, those can also be amplified. So we can have some symptoms. We may feel like we're more bloated. We can gain a little bit of weight too with progesterone and with estrogen. Estrogen and hyaluronic acid are super closely tied together, and that equals hydration. So your cells plump up. We always kind of associate estrogen with being like juicy.
Yeah.
So over time, we lose that juiciness. And when we bring estrogen on board, or even bring progesterone on board, which can amplify estrogen's effects, we can have a little more of that kind of juiciness, and we can have our cells are more plump, our skin is more plump, our tissue is more plump. And that's a good thing. But for women, it translates into I gained 4 pounds on the scale. I feel bloated, things like that. So oftentimes it's just the recalibration of getting into this kind of new reset with our body with hormones. Progesterone is actually a natural diuretic. So if women are feeling really bloated, oftentimes you need to increase that progesterone. I know that seems counterintuitive, but sometimes it's increasing it to get some of that water weight out. And often just kind of looking at the hormones across the board. How is everything else? How are your thyroid hormones? What does estrogen, progesterone, and testosterone look like? Because they really are a family that functions well together and dysfunctions well together. So we want to make sure that we've got everything sort of checked and sort of, but give yourself some time when you start hormones. It might be a few months before you're like, okay, I'm recalibrated, feeling really good in my body, because there's that kind of panic if you see the number on the scale go up, and we don't want to do that.
Yeah. And
Yeah.
I hear a lot of women saying, well, I have all these estrogen dominance symptoms in perimenopause,
Hmm.
so I don't want to go on estrogen because I already have estrogen dominance. And
Hmm.
so is that a sign that you should just be doing progesterone? Or because, perimenopause is such a weird time. I mean, you can have a time of the month
Yeah.
where you have that estrogen dominance, and then it kind of, as you get closer to your period, it kind of comes down a little bit. So
Yes.
is that a sign that you shouldn't be doing estrogen? Or
If you really have, I mean, I would say if you look at like the symptom checklist, there's a lot of symptoms you can look at to say, If you have symptoms, so typically the way it starts is progesterone declines first. So we usually bring progesterone on first. And so you're going to have that imbalance between progesterone and estrogen, right? So you bring that progesterone back up to meet estrogen. So then there shouldn't be that kind of estrogen dominance. Then you'll go through a period where it's up, down with estrogen. That's the point at which we typically will say to bring estrogen on board, which seems counterintuitive, but it's all about a feedback loop in our brain to our ovaries. So estrogen drops, our brain senses it, so it shouts at our ovaries to bring that estrogen back up. So we'll have a really high level of estrogen, then it'll drop again. Then our brain senses it, so it sends a signal. So we're in this loop of high, low, high, low. So if we bring estrogen on board, our brain goes, I'm good. I don't need to be shouting at the ovaries anymore. So estrogen levels tend to stay more steady, less highs and lows. So we feel much more even keel and less of those highs and lows. So bringing a little bit of estrogen on board at that point is can be very, very helpful for women.
Okay. So it helps
Yeah.
level it out a little bit.
Yeah,
Yeah.
exactly.
I was telling you before we started here that I had started the progesterone cream because I had heavy periods. And
Mhm.
I don't want to speak too soon, but I did have a really, really light and what probably most people have for periods last time.
Yeah.
And I was like, oh my gosh, if
Yeah.
this progesterone cream is literally all I would have had to have done for the last 9 years to have a normal cycle, I am so mad at myself for not starting this earlier. It's just,
I know.
I think a lot of women want to just power through. They want to say, I got through menopause without having to use, HRT. I even have women tell me, I want to get off of HRT. I'm working
Mhm.
hard at my fitness, my nutrition, so that I can get off of HRT. And by all means, we still need to be doing all of these other things. I mean, you do it, I do it. We need to be strength training, focusing on whole foods and, protein intake, and our lifestyle factors like sleep and stress, and all of this needs to be in line to maximize, the results you're going to get from hormone therapy as well.
Mhm.
But also, if you don't have to suffer, like,
Yes.
why would you? And it doesn't make you weaker because you
No.
decided to use this. I think and I felt the same way. Like, I don't like to take anything. I don't like to take any drugs. Like,
Yes.
I want to be all natural as much as I can. I try to limit chemicals in my household. Like, I want to go the natural route, but you were saying, and you can elaborate on this. This actually is the natural route.
Yeah. Yeah, because we're always looking to like the herbs and all the things. I agree. Lifestyle, huge. Sleep, huge. Food, huge. All the things. Strength training, absolutely. But at the end of the day, doing all those things is not going to turn our ovaries back on. And that is what is going to produce these hormones in amounts that are going to be enough to protect our body systemically. So what happens is then women end up on all these medications because they've lost all those protections, the cardiovascular protection, the bone protection, the brain protection, the vaginal protection, things like that. So hormones, if you think about them, we're always looking to herbs. People are like, well, I'll use an herb first. And herbs can be great, but herbs are plant medicines. They're not made in the body. Bioidentical hormones are made in the body. So really replacing our hormones with identical hormones is really the most natural thing from our body's perspective we can do because our body knows these hormones. It knows what to do with these hormones. We don't know how that herb is going to affect us. We know how it's supposed to affect us, but it might not, or it might, just depends. But it's still not. You can bring in all, like we were talking about Vitex. I love Vitex, chaseberry,
Yeah.
chase tree berry, for progesterone to help produce progesterone. But at the end of the day, when your ovary is no longer, or that connection I was thinking about is like spotty Wi-Fi connection, when it's no longer producing, there is nothing you can do to make your ovary do that. It's like give your child a lot of milk to try to like milk with hormones, try to get them to go through puberty. They're going to go through puberty when they go through puberty. There's nothing you can do, nothing that we would want to do to make that go faster anyway. But in the same vein, there's nothing we can do to stop perimenopause and menopause from happening. This is the natural order of it happening. But now we live a long time. We weren't living that long before. Now we are because of all of these things we've done, these kind of medical interventions and antibiotics and, all of the things that we can do to live to be 80, 90, we need to think about hormones, just like we would think about thyroid hormones or insulin. If our pancreas was no longer producing insulin, we would give a woman insulin, or thyroid, we would give them thyroid hormones. It's the same thing. If the organ's not producing, we just bring in hormones to help optimize the body overall. Yeah, no need to suffer.
Yeah. Someone is at my door.
Are they?
Hopefully my dog doesn't see
Yeah.
him and start barking. Hopefully he doesn't ring my doorbell. It's like one of those like pest control or
Oh
something.
gosh, yeah, I know.
I'm just gonna ignore it.
Yeah.
But we're wrapping up here anyway.
Yeah.
So
Yeah.
I will I if you want to give me your link to I know you have an HRT guide that I
I
think
do.
would be
Yeah.
very helpful to people. I can
Mhm.
put that in the description here, and also your Instagram handle where they can find you.
Yeah.
I know you have, which I'm in your community that you have. It's on a different app, but
Yeah. I
it,
know. Another app, but it's like,
another app, but
I
it's a
know.
community of people who are all talking about this kind of thing and just continuing to be educated. So
Mhm.
we can share that as well if people are interested. But
Yeah,
you,
that sounds great. I'll send all that to you. Yeah, for sure. And I'm updating the guide later this year. So there's always, anytime we learn anything new, I always like to update it. So the guide will be updated as well.
yeah.
Yeah.
Okay. Well, thank
Good.
you so much.
Thank
You have
you.
so much knowledge, and I just love learning about this. And I know that people are going to have questions, but I think that you do a great job in that community of answering them, and also on Instagram. I know you're always sharing a lot of busting myths and
Yeah.
talking about just women's health. I mean, this is women's health,
Yeah.
especially at this age.
Yeah. Thanks so much, Sarah. Thanks for having me. It's such an important conversation. So I really appreciate it.
Yeah, you are welcome, and thank you.